Schizophrenia is one of the most misunderstood mental disorders. Many people believe it means having multiple personalities, but that is completely false. The reality is much more complex and often more terrifying. This video is part of a series on schizophrenia where we explore its causes, symptoms, different types, and treatment options. If you want to understand this disorder fully, stay tuned for upcoming videos. Schizophrenia is a severe mental disorder that affects how a person thinks, feels, and behaves. It can cause hallucinations, delusions, and disorganized thinking, making it difficult to distinguish reality from illusion. To be diagnosed with schizophrenia, a person must experience at least 2 of the following symptoms for 6 months or longer, with at least 1 from the first 3. Delusions, false beliefs that persist despite evidence to the contrary. Hallucinations, hearing, seeing, or feeling things that aren't real. Disorganized speech, incoherent or fragmented sentences, disorganized or catatonic behavior, unpredictable movements or rigid postures. Negative symptoms, lack of motivation, emotional flattening, or reduced speech. Common myths about schizophrenia. People with schizophrenia are violent. The vast majority are not dangerous and are more likely to be victims of violence. Schizophrenia means multiple personalities. This is completely false. Schizophrenia is not dissociative identity disorder. People with schizophrenia can never recover. While it is a chronic disorder, treatment can help many life-fulfilling lives. What causes schizophrenia? Genetics. Having a first-degree relative with schizophrenia increases risk, but most people with schizophrenia have no family history. The disorder involves multiple genetic variations rather than a single inherited gene. Brain chemistry and structure. Studies show abnormalities in dopamine regulation, glutamate function, and reduced gray matter volume, especially in the prefrontal cortex and hippocampus. Environmental factors, early childhood infections, prenatal complications, malnutrition during pregnancy, and psychosocial stressors, such as urban upbringing and migration, are associated with increased risk. Substance use, heavy cannabis use in adolescence, particularly in genetically predisposed individuals, is linked to a higher likelihood of developing schizophrenia. There is no cure for cause of schizophrenia, but treatment can significantly improve symptoms and quality of life. Antipsychotic medication targets dopamine pathways to reduce symptoms. Cognitive behavioral therapy helps manage delusions and improve daily functioning. Social and vocational training supports independence and reintegration. Schizophrenia is not a hopeless condition. With the right treatment and support, many people can lead stable and meaningful lives. What do you think is the biggest misconception about schizophrenia? Thank you for watching. If you want to learn more about schizophrenia, check out the other videos on this channel. There's much more to explore.